Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
While they have some for patients, they ran out of the flu shots for the staff.
Wow.
Wow.
But they'll probably have to find out too.
What is this, at hospital?
Yeah.
Wow.
Well, I'm gonna need to show this article to my ex-husband because he came over here the other day and I was like, well, you need to get your flu shot. And he's like, I'm not getting it. The last time I got it, I got sick. And I said, but it's more important to get it this year than ever. No, I'm not getting it.
True.
I
Yeah.
said, okay.
You tell them the truth.
He had the bypass surgery on his heart, all of that. I'm like,
Oh,
what?
no. Yeah.
Yeah. That's about a year ago.
Goodness.
Yes, it's been a year, almost, a year. It'd be 2 years in
Oh.
April. Yeah.
Yeah, wasn't he on dialysis for a while?
Yes, he was on dialysis for a while. Mm-hmm.
Wow.
Yeah, he had a tough time, but
Yeah.
pulled him through it. So, yeah, you gave him good advice. It doesn't give you the flu,
Yeah.
but when you get the shot, the body does react to it. Your immune system is hyped up. And
Yeah.
sometimes people consider that, or if you were exposed to it before you got the shot, that's not so.
Yeah.
Anyway, this is an article that I thought was interesting because it talked about those everyday habits that could destroy your liver, which is an important organ.
Yeah.
It's really more important in many ways than any other organ except the brain because it breaks down most of the poisons even before the kidneys. And at least with the kidney, you have dialysis, but with the liver, you don't have a
No.
equivalent to dialysis for the liver. So it's really important not to destroy your liver if you can. And nowadays, what do you think is the number one cause for liver disease?
Alcohol.
Some say alcohol, and I read an article that said alcohol. But what is one that's taking over the place of alcohol?
Fatty liver.
Yeah, that's right, fatty liver.
Oh, my goodness.
Yeah, that is associated with many other diseases, but more often with obesity and diabetes than anything else. So this talks about how Tylenol is often one of the reasons why we have to do liver transplants, because taking too much Tylenol will damage the liver. And it's interesting, green tea is so good. You have dietary supplements, green tea extract, it can sometimes cause problems. Along with the muscle builders who actually often take testosterone. And they also talk about the importance of drinking more water. Then there are other medications that it talks about that. One of the things is okay to drink coffee because it seems like coffee may protect against fatty liver disease. And in a recent study in the Post also, it talked about drinking 2 or more cups of coffee reduces the risk of cirrhosis, and also drinking more than 4 cups of coffee a day reduces the risk of cancer. So it's interesting. We learn a lot. Limiting sugar, and most people recognize that sugar is one of the most dangerous aspects. That's why we love it so much. Is that anyway? It's a dangerous sugar. And then, of course, this article doesn't talk about the role of the medication that people take for myalgias, but that also causes liver disease. We rarely ever talk about oral health, but keeping your teeth in shape and keeping everything okay contributes to liver disease as well. And so, how often do you go to the dentist?
Not enough.
I do. I do.
At
Huh?
least twice a year.
Yeah.
Yeah, at least once a year is if you have good. If you go, or if you go twice a year, that's very good. But once a year is minimum. At least once a year. Most of us taking too much salt if we put salt on our food. Of course, damage associated with hypertension. We often don't recognize that this can also result in water retention, which inflames the liver. So these are some of the things that we have. And this is an interesting article identifying that bread and potatoes and high glycemic foods before going to bed hurts the liver because it sleeps at night along with the. It's interesting. The brain is cleaning out itself at night, and the liver is working.
Dr. Calendar, does that include cheesecake?
Well, that does contain a high amount of carbohydrates.
Woo! And ice cream.
Yeah,
Cheesecake and
especially
ice
ice cream,
Okay.
which I love.
Oh boy.
Yeah. Exercise every week, not just during a diet. We've talked about 150 minutes a week is minimum, but this talks about how running, walking, and swimming is really good for you. It's too bad you can't do swimming like John likes to do it, but anyway, running and walking do well. Now, we talk sometimes about sleep being a priority and the fact that you need 7 to 9 hours a night. And it's true that few of us can actually get that. And then, of course, Maya gets, you still at 12 hours?
Since the pandemic, it's a little, up and down.
Good, good.
Disturbances. Yeah.
Because it's healthier to do less than 12 hours.
Right.
Yeah. And then, of course, this answers your question, Candidly, about sugary drinks.
Oh, yeah.
But the more you drink, the more you might risk your liver. Even though diet sodas eliminate that, they cause other problems. But, and then the old adage, eat more fruits and vegetables, which is for the sake of your health, not only for your liver. If we stuck to fruits and vegetables, we'd probably live much longer, right, Daryl?
I'm hoping.
Well, all of the data is on your side. Now, it's interesting how the berries are just, and the beans, which you talked about ad nauseum, and beets, which we talk about. Anybody like beets?
I like
do.
them.
No.
I don't like it.
Away from the beets, that's a hybrid food.
Oh my goodness.
Oh, come on, Daryl.
Yeah, well, even though it's a hybrid food, it's very good for your health. Interestingly enough, one of the few hybrids that are really good for your health.
Yeah, carrots. Orange carrots are also hybrid. So if you have a choice, get a purple carrot or the ugly ones. If they're ugly, beautiful.
Oh.
All right. Trans fats are just about outlawed these days, aren't they? Yeah, but they scar the liver, and there's so much data on trans fats that they've barred them from most foods. Isn't that the case? As far as I know, they are barred from. They used to be, especially in the fried French fries.
Oh.
But they have barred that now from this. Weighing daily is something that's good. Of course, if every day you weigh, you're going up, that's not good. But we talked about the BMI and what's good and what's not. 25 to 30 is overweight and over 30 is obese. And we have more obesity, as we talked about, in the United States than in Europe. It's nice to see they're talking about how to tackle stress and
Yeah.
meditation along with exercise. Very good at that. Although they don't really talk much about meditation, but I think that's underappreciated in terms of stress reduction. Vitamin B12 is interesting because that deficiency causes so many problems. And if you ate the right food, for the most part, unless you have an enzyme deficiency. It talks about if you're a vegetarian or vegan, you're at risk for vitamin B12 deficiency.
Wow.
But some cereals and brown rice are fortified with vitamin B12, so keep that in mind. Now, we don't know a lot about herbal supplements because often we don't know what's in some of the herbs because they don't have it on the bottles. But some of them can cause liver disease.
Oh my goodness.
Are supplements regulated by the FDA?
Herbal are not. For the most part, they're not. And that's one of the problems. If they really would identify everything that's in the herbal supplements, it would be okay.
Oh my goodness.
Because then you could look and see, and for many of them, they have the labels. It's just that often people don't look at them. And that's why if you're taking herbal supplements, you should let your doctor know so he can look at the ingredients that are in all of the herbal supplements.
Yeah, well, that list there of harmful supplements, those aren't anything that I use, and I'm a herbalist, but I don't order I don't order any supplements. I get the ingredients, grind them, and encapsulate my own.
Oh,
Amazing.
that-
How long have you been doing that, Daryl?
I've been doing that for 2 years.
Wow.
That's good.
Yeah.
Tell the difference?
Well, yeah. Let's see. I use what they call Nigella sativa to control my hypertension, and it works really well
Wow.
along with diet. I've used another herb to help a friend who's a diabetic. It regulates his blood sugar. His blood sugar level. I've used another herb. Somebody was developing kidney stones and
Oh,
resolve his kidney stones, and so I don't charge for herbalist services. I just well, no, I don't, because that's practicing medicine without a license. I'm not going to fall in that trap.
Okay. All right. Anything else on this one, John? Okay.
Cigarettes.
Yeah, of course. And the cholesterol. You'd asked about cholesterol before, and HDL is the protective cholesterol. LDL is the bad one. And then, of course, we know much about eating too much red meat because many of us do. And so it's cutting it down to really once a week or so is something that's desirable. Now, because of the new hepatitis C medicine, liver cancer and hepatitis C are no longer the cause for liver transplants like they used to be. But we still haven't, we do have a vaccine for hepatitis B. So you can be vaccinated for B. Should be. Almost all health professionals are vaccinated for B.
right. That is a must for those who work in dialysis, all the nurses every year.
Yeah.
Yeah.
You hear what it says about eating heavy dinner in case anybody who does that.
Yeah, when I go to the diner or order out dinner, it almost seems like the dinners that you get are so big now.
Yeah.
I end up splitting them into
Yeah.
two or three meals.
Yeah.
Yeah.
Mhm.
We got Red Lobster the other day, and my order, I split it up I had 3 full meals out of that one meal.
Yeah, okay. No, the thing that bothers me much about the annual checkup we talk about in the app is that often they don't pay for the physical, and at least Medicare doesn't. So the doctor has to identify reasons for getting blood tests, which I think is, for getting a physical, which is unfortunate. Anything else on this one, John?
Ooh.
Yeah, this is the signs you have liver disease. There are a lot of symptoms. Of course, the one that is most one noted is the pruritus, itching, and the yellowness.
Mm.
But all of those are good to know about. Actually, you probably are not symptomatic for liver disease until you've lost 90% of the liver.
Oh my goodness.
So that you can be asymptomatic until it's very late. When you get all of these signs, you've lost over 90% of the liver function.
Mm.
Yes.
All right.
Okay, go to the next one. This is an article that Bill Gates talks about how COVID-19 has set global health back decades. He spent all that money trying to improve global health. And he said it set the world back 25 years and 25 weeks. And when you think about what is done to the economic damage in this country, you can recognize what it would do to other countries that aren't at the high level we are. So, and it's been devastating to our economy. So many people lost jobs and on the verge of homeless. That the impact of this pandemic is so huge that it's hard to think of how many trillions of dollars it's cost us. But Gates is optimistic.
Dr. Calendar, when he says that it takes us 2 years or even 3, is he stretching it or that's being practical?
He's an optimist. It's hard to. I hope he's right. You think of all the jobs that now, as of today, United Airlines is firing 35,000 people.
Oh, wow.
Can you imagine?
That's
35,000 people, and that's a direct result of coronavirus.
Oh
So
gosh.
that's just one airline. And think about all the other airlines and all the other businesses that have been cut out as a consequence. This is an article when I read, I thought of you, Daryl, see what you thought about this. This is a so-called Budwig diet developed by a pharmacist and biochemist. And it emphasizes omega-3 fatty acids. And this talks about what it is. Flaxseed, you deal with that, Daryl?
Yeah, I eat flaxseed every day.
Mm-hmm. And this is the prime product of what the Budwig diet is all about. And he noticed that the omega fatty acids in flaxseed stopped cancer cells from growing, and therefore he made a diet that includes fruit, vegetables, and fiber, but excludes sugar and includes, of course, flaxseed. And his regimen also includes exposure to the sun for vitamin D naturally. He felt that the benefit in time would show that it works. And so far, it turns out that the data supports what he says. And the rest of this article talks about it. But as with everything else, it has its strengths and its weaknesses. And there have been some articles which suggest that there are some harms that are associated with it. Now, the only problem with the diet is that it hasn't had the same kind of rigorous studies that are associated with other trials. But the basic hypothesis seems to make sense.
Yeah. Dr. Callender, I think you've referred to the Green Zones book before. Is that right?
Which one?
Green Zones. There's a book about green zones around the world.
Yeah.
Okay. And that talks about which countries and which cultures have the healthiest outcomes as far as major diseases like cardiovascular, cancer, and so on. And the green zones are the ones that have the lowest incident of dairy, meat, and sugar consumption. Alcohol being part of sugar because that's the way it's metabolized. So, of course, the United States has the worst health outcomes because it has the highest dairy, sugar, and meat consumption. The Budweiser diet it seems to be consistent with that because it.
Yeah. As a matter of fact, it's almost exactly like that. Any other comments about that? I think it's good for us to know about that flaxseed. How do you deal with the flaxseed? Do you do that the same way you put it in pills, or how do you?
No. Okay. Yeah. Every morning, part of my breakfast is I make Belgian waffles. I make them from scratch, and part of my ingredients are golden flaxseed meal, spelt flour. But there's no dairy, like typically what you're going to use for waffles or pancakes. But it has good taste and texture. But yeah, so that's just part of my daily diet.
Okay.
Yeah, with me, I also when I cook, like in my crock pot, when I do my chicken wings or things like that in my crock pot, I sprinkle flaxseed on it. With my cereal, I'll sprinkle flaxseed on that. Definitely in my smoothies, my homemade smoothies, I use a lot of flaxseed in that. When I go to Smoothie King to get my smoothies made, I get double helpings of flaxseed. Not only, but it's a good source of fiber. It flushes you out. But I didn't know about it reduces the risk of cancer.
Yeah.
So that's actually a bonus there.
Of course, you could do things like you could take a good thing and cancel out all the effects with a bad thing. And so smoothies are advertised as being very healthy, but they're one of the most dangerous things that you could possibly eat because of the high sugar content. So I mentioned Belgian waffles, but I don't use syrup. I use blueberries to sweeten them.
Oh, that's cool.
These habits will make you a better doctor and person. This is an interesting article because many people talk about physicians not having work-life balance, which is justly stated. And these are some of the things that they think will help. And they talk about journaling, which I don't think I've ever done, but it's an interesting idea of journaling everything that you do. I do. One of the things that I've noticed is that, I think we talked about this before, that when you wake up in the morning, you may have great ideas and thoughts, and writing them down when you wake up is not a bad idea. And this is the kind of thing that when things come into your mind, to jot them down so that you can look back and reflect. And if you do that, that's something that
I keep a notepad right next to the bed because I hear music in my sleep sometimes, and I can get up and jot down my ideas.
yeah, yeah. Any other ideas or thoughts about that?
I think it's a good idea. I think it's a good idea because when I wake up in the morning and I think of something I need to do and I don't write it down, go back to sleep, and when I wake up again, I can't remember what it was.
Wow.
I have that thing too. So I have a book that I write down thoughts that came to mind after sleeping.
This also recommends web-based journaling. So I use my my Outlook calendar, and I take notes on there as to my schedule for the day.
Oh,
And I can go back and refer back to it months, even years later, to see what happened.
yeah.
Just scroll back up. Yeah, that one. Where it talks about short journaling session, useful way to capture whatever your subconscious mind may have been processing while you slept. That's called a dream journal, and I've done that. That can be not as a way of analyzing yourself, but you spend a third of your day in dreams, and you kind of lose the consistency. In other words, most people don't remember what their dream world is like for a third of their day, but you can really get in touch with that by journaling it.
Yeah, it's a good idea. Very good. Okay.
The other thing, Dr. Calendar, sometimes composers think of songs during the night. And if they wake up, they can write them down, because if they don't write it down, they'll forget all about that song.
Well, that's what Buchanan was saying. Yeah. He does it.
You ever actually done that?
What, forgotten or?
No.
No, he wrote them down. That's what he said.
I wrote some music down that I've composed pieces off of
Oh yeah, I remember one, Bustin' Loose.
several times.
Really? Was Bustin' Loose one of them?
No, the part of Bustin' Loose was one of them. Yes, part of the intro to it. Yes.
Mindfulness has become very popular now, and in many ways, to me, mindfulness is really what meditation is all about. And the difference is that sometimes they talk about it, you have to be seated and focusing on your breathing, but there are many ways you can be mindful. That's one of the ways. It's thought that the lack of it is one of the reasons why you have burnout and generalized anxiety disorders. And this is very common in the field of medicine. So mindfulness practice is desirable, and it's becoming more and more popular as people recognize how important meditation is.
Yeah, I pretty
Whether
much.
it's Zen type or not.
Yeah, I pretty much meditate every day a little bit, but I've started doing yoga now almost a year now, and we always end up the practice with Shavasana, it's called, and I've reached some very good levels of meditation doing that. I mean, it's like total relaxation, and it's very good. It's very good for me. I know that.
Yeah, and it's good for mind health, you know, when you think about it. We talk about health and other aspects of your body, but often not understanding the impact of mindfulness on the brain and on the rest of the body as well. We talk about exercising, but in many ways, this is brain food in many ways. And then you were talking about the yoga, and they have demonstrated how yoga improves the brain.
I need a lot more.
Well, I think we all do to stave off age-related mental decline, as we talk about it. PTSD benefit from 5 months training, essentially. That's such a problem.
Righty. Here we go.
I thought you'd like this. I thought Darren would like this one. He talks about them so much, and it just describes what they are. And it's interesting how they talk about it, that they wouldn't exist if you didn't have special protection. It talks about the hybrid and GMO food differences. And what was alarming and surprising to me was that how many hybrid foods we take for granted. I didn't know that bananas, I guess Honeycrisp apples are a special type of apples. Are they supposed to be sweeter or something?
Well,
Honeycrisp apples?
Oh, yeah. Yeah, just a little bit sweeter, a little bit of tartness. The best bananas are the little small bunch. Let's see. In Hawaii, you can't get a bad banana, but they're not the big bananas that we get over here. Okay, like apples. There's some when you take totally different species and you mix them together, then you get a bad result. But there's so many different types of apples, and they're so closely related that when you do man-made hybridization of apples, you can never get a bad result. So all apples are basically hybrids, but they're all good.
Looking at grapefruit is interesting. That hybrid fruit that is a problem for many medications.
Yeah, so crossbred like grapefruit, right, very much a problem. But your apple hybrids, that never a problem.
Well, this is an article that talks a bit about some of the good parts of hybrid foods. But what is amazing to me is how many hybrids that we take for granted. You know.
Right. Yeah.
Looking at that list.
Yeah.
Wow. Beets, as he mentioned, carrots, corn, potatoes, celery, cauliflower, nuts and seeds, cashews, almonds. You notice you don't see walnuts on there.
Right. I mean, you just think about it. Anything without seeds in it that's supposed to have seeds, you know, that's man-made hybrid, and it's never good for you. And so, like seedless oranges, seedless watermelons, bad deal. If you can find the watermelons with seeded, you know, like at a farmer's market, that's where you're more likely to find them. Get them there. Or, you know, you might have to really search for oranges with seeds, but those are the best.
Well, you know, it's interesting. I've never seen watermelon without seeds. I guess where I grew up and where we shop, they always have seeds. I didn't realize there were seeds.
It's very popular now. You can find them everywhere. It's the seedless ones sometimes that's hard to find.
Yeah.
I mean, it's the seeded ones that are hard to find.
Seeded are hard to find.
Yeah.
Which ones?
Seeded are hard to find.
Seeded.
That's all I ever have. I sent you. We go to the Giant, and that's all.
Yeah.
Well, let's put it this way. That's all my wife brings home. Maybe she knows better.
Well,
Yeah.
sometimes you have to have come to Jesus meetings with those people that do your shopping.
Yeah.
Well, she does a good job. I mean, but because the fact that I've never seen the seedless watermelon, I guess she knows more than I do about shopping.
There's those watermelons that have those little teeny white seeds
Yeah.
Yeah.
instead of the big black ones. Because Dr. Callender, we
Yeah.
talked about, was it harmful to, eat the seeds of a watermelon? We talked
Swallow.
about, yeah, swallow.
Swallow.
It causes pregnancy.
Oh no.
He said that with a straight face too.
Yeah. Now this is isn't that amazing that we've had 32 million cases of COVID already,
Oh my gosh.
claimed almost 1 million lives. So
Oh.
those are staggering statistics.
Mm.
Yeah, and still we have people who say they wouldn't take the virus. I'm sorry,
Vaccine.
wouldn't take the vaccine. They're taking the virus, whether they want it or not. But would take the vaccine. What are your thoughts about Trump's ideas about interfering with FDA to change their standards?
All he's interested in is getting reelected. Anything that would give the impression that he's doing something good, and it's all smoke and mirrors. He's really blown it. He got rid of all the programs that Obama had in place to prevent pandemic, and they were aware of it with H1N1 and Ebola, and they had it in place, and he got rid of all of that, and it's very sad, and hundreds of thousands of people have died as a result of it.
Well, he's so concerned about Obama and wiping out his legacy.
That's
Yeah.
right.
That's his #1 priority, other
Right.
than getting elected. Wipe
Yeah.
out Obama from everything. Yeah, which is tragic. Well, what is really going to be interesting is to see. Any of you watched the debate?
Oh yeah.
Yes,
Yes.
I did.
Yes.
It's horrible. Horrible.
Awful.
Horrible.
Just awful.
Yes.
Very sad. Very sad.
Frightening, huh?
It's embarrassing.
It is.
Very frightening.
Well,
would
what
not-
bothers me is that he wasn't much different before he was elected president.
Right.
He's
right.
just acting the way he's always acted.
I think he's worse. He has the power. He
Well,
tries
because
to
he's
set
been
everyone
emboldened
up.
by becoming president.
Right.
And I think you're right. He's worsened.
He's worse.
Yeah, he's
What
worse.
really disturbed me the most was that he would not condemn the white supremacists, and that really scared me a lot.
It didn't scare me. It just helped everybody else see who he is, because that's who supports him.
And it was as though he was talking in code. That's why I'm afraid for election time. I mean, if you can vote early, vote early. The comments that he made was almost like telling the white supremacists, be on guard. I'll give you the signal.
Yeah.
Yes,
And he's
that's
already
right.
saying, I'm not leaving the White House. So he's
Right.
sick.
Well,
Yeah,
those are his biggest supporters.
I got my ballot. It's all filled out, ready to drop it in the mail.
I got
I
a
have
good
it
day.
too.
I did mine yesterday.
Yes, we did it
Really?
yesterday, and we're going to mail it today.
Yeah, okay, I gotta do
You
that.
you can't be sure that it's going to get to the right place.
You
Well,
take
I'm
it there. You take it there.
Yeah,
I
I'm
took
dropping
mine.
mine in a box
In a box. Yeah, my husband is going to do that. Yes.
at the
Yeah.
library, and they have a guard there with a gun.
Oh, really?
Oh yeah. Oh yeah.
I'm gonna give my ballot to
A gun. Oh, my
Sylvia's
goodness.
husband.
Mm.
Well, I think the FDA had the right ideas to make the standards high so that people will take the virus. But How many people actually think that they'll have a virus before election day?
No, I don't think so.
I
You
don't
mean,
think so.
you mean a vaccine?
No,
I mean, yeah, vaccine.
I don't think
There's,
so.
just like Trump said, they already have the vaccine.
Really?
Yeah, they've
Oh.
been had
That's
it,
all.
but they
Where
have
is
to
it?
test it. They have to test it. It's not.
No, well, you can't use it until it's tested.
Right. That's what I'm saying. They have a vaccine
Oh.
right now, but they can't use it until it's efficacious, right?
Right.
So it's safe.
So in many ways, we don't have a vaccine that's been tested. So therefore, the promise that we'd have a vaccine before election day is kind of a fake promise because, yeah, we have a vaccine, but we can't use it. So what's the good of it?
But
Yeah.
see, he's playing to the ignorance of some of his voting base, some of those hillbillies and rednecks who
Yeah,
don't have any clue what he's really talking about.
right.
You know, when he said we have a vaccine, that's right, we do, but it's not
Right.
safe, it's not tested, and that isn't that exactly what the Russians did?
Yes.
The Russians gave
Yeah,
it to
the
the
Russians,
whole
right.
population, but
Yeah,
the whole population is phase 3 testing.
yeah.
And they're selling it too.
Wow.
Oh, wow.
Wow. I didn't
Some
know that.
countries are buying it because
Until it's
they
approved.
can't.
Right now, there are some potential vaccines, but they're not approved, so they're not a vaccine.
There are, you know, a vaccine is it's not approved.
Well, this is something that we all know that the vaccine will be available for most people in the middle of next year. So I think most scientists and other people recognize that even if we had the availability of a fully tested vaccine, that would occur maybe in November, December, but it wouldn't get around to most people until next year anyway. So
Carol, I figured out what to say that will set him off.
What?
Fauci for president. That would set him off.
Yeah, that would that might do it. Yeah. The biggest issue is trust, and
Yeah,
the president has made us distrustful of
yes.
CDC and
Right. Vaccine and everything,
the
right.
vaccine and everything else. That's one of
Mm,
the issues. And so rebuilding the trust is the biggest problem.
yeah,
How
If
do
you, Dr. Calendar, if you believe that the virus started in China, Wuhan, China, where they were experimenting, and the rumor is out that it was an experiment gone bad. Wouldn't you think that whatever they did that went wrong and that they were working on, that possibly the antidote could be a part of that same experiment that they were doing?
Well, since we don't know anything about that, it's all conjecture. So, and I don't know what to say. You would think that if that were the case, which I don't think is the case, that they would use it in China, where it started, but they didn't. So it's unlikely. But anyway, it's interesting conjecture. That's Francis Collins.
Yeah, we have another article on him in our app.
Right. Oh, we do?
Yeah.
Oh.
Yeah, he won
$1 million prize, right.
Yeah, yeah, we have that article. I don't know that we could put it in the app or anything, but
Well, that's who helped train Dr. Dunstan.
right.
Yeah, these are Trump folks. See the Trump sign?
yeah.
No vaccine. Why?
See the Trump sign right there?
Yeah.
Those are Trump folks.
Dr. Calendar, I have a question for you. With all this vaccine and all that, I hear on the television that the Black doctors have formed a coalition about this vaccination because they do not believe the system, what they did in Alabama, experimentation. What do you have to say about that?
That's past history. And we need to pay attention to the fact that if we don't get the virus, we'll die. And so, yes, it is true. We need to know that the past history resulted in many changes that are not here today. And so building up trust is going to be the main job. And right now, I think that's the most important thing we can do is rebuild the trust. That's easier said than done. But there have been so many changes in the way in which research is done since that time that those things we have to make sure that they don't happen again. But the protocols are in place. We just need people to believe and trust and take the vaccine when it's available. And taking the flu vaccine is a start.
The thing about the flu vaccine is we'll have a history of people not trusting the flu vaccine.
Yeah.
Yeah, that's why I said that's one of the first things to do is to improve trust in the flu vaccine, get people to be vaccinated. That's why there's a lot of activity around. And I think since, because of COVID, rebuilding trust becomes harder because we've got to reach everyone about it. And whether we use the free press, the radio, television, or whatever, it becomes critical to begin the retrust phenomenon with the flu vaccine. And then it hopes that it will spread to the coronavirus vaccine. Now, this is just the fourth COVID vaccine candidate going into phase 3 trials, which I think there's another group that had a temporary cessation of the vaccine.
AstraZeneca.
No, AstraZeneca has already started back. There was an article I saw yesterday that said there was another vaccine that was stopped for a short period of time. It wasn't one of ours.
Oh,
It wasn't
okay.
Pfizer or Moderna. It was another one from that country. Now, one of the viruses is a live virus, and one of them is the activated virus, Moderna's. And there's one vaccine, the Johnson & Johnson vaccine, can be administered fully in one dose. That's important to know because the other vaccines require 2 doses. So, but the problem is that the Johnson vaccine is just starting. So that means the results will be available, and so that vaccine is likely not to be available before.
John, can you scroll back up so I can see what it said about the spinal cord? Yeah. Okay, thanks.
And it looks like the Johnson & Johnson might be that because he only requires 1 shot. And also, it doesn't require anything other than basic refrigeration, whereas the other vaccines have to be stored at minus 94 degrees. So anyway, it's interesting. Each vaccine has its own differences and steps.
Hey, Dr. Calendar, I was thinking about you had these companies making the vaccine, and I'm like, do they all, you're saying they don't all have the same ingredients? I mean,
No.
at some point you would say, this is the vaccine and it's one ingredient. I mean, we all have the same thing in it.
No, but they don't, because some use different parts of the virus. And so depending upon which part of the virus they use, it determines what type of vaccine you have. And so each of these vaccines is different. Although they use the coronavirus, they use different parts of the virus.
Mm.
So
It's
they are
interesting
using the
to,
virus, but different aspects of the virus.
That some
but
of
it's
them are
interesting
using
that some
RNA.
vaccines is only one vaccination and others are two. You need 2 shots for some and 1 for others.
Yes, that's what it, yeah. That's what it says. One, the Johnson & Johnson, you only need 1 shot.
1,
For
yeah.
the others,
Okay.
you need 2 shots. And yeah, each of those has their own unique differences. And so the one that has the best results is the one you want to have now. And that's why FDA wanted to have a high standard so that you don't get an inferior one to come in, which is what Trump is opposed to.
Dr. Callender, what efforts are being implemented to, in a general way, boost people's immune systems? Other than, I know eating certain foods helps to boost your immune system, but are there any other ways that they're doing that?
None that I know of. Vaccination is probably the commonest one.
Mm.
Dr.
Yeah.
Calendar, I have a question for you. Which
Yes.
one would you rather take, the coronavirus vaccine, the one that you have to take 2 times, or like Johnson & Johnson 1 time?
The one that has the strongest ability to produce antibodies. That's the real bottom line, is how effective is it at getting your body to produce antibodies against the virus. And so if there was a vaccine that had a 90% production of antibodies, I would favor that over one that has 70% production of antibodies. So the one that's most effective or efficient at getting your body to produce antibodies. And those tests, the results of those tests would be available for you to determine, and FDA wanted to set a minimum standard. I don't know what that standard is yet because they haven't announced it. And Trump may interfere with that. And that's one of the concerns. But you want the one that is most effective at producing antibodies to the virus.
Dr. Callender, back to my question. You know, and it's even in the app that we're working on is what vaccinations you should get yearly and every 5 years, and so on and so on. And we have them listed. We're talking about, you know, polio, tetanus, you know, and the others. We're getting those on a regular basis. So we have to keep doing that, even though we're waiting for this other vaccine. Is that correct?
Yeah, because we got other diseases that would kill us otherwise. And so that's why being vaccinated against a lot of other things like pneumonia, other things coming. That's why the
Shingles.
The things you need to be vaccinated, especially over 65, becomes critical because that's when your immune system wanes or decreases. So you need to know which of those vaccinations you need to have when you get over 65.
Yeah, shingles and pneumococcus, and it's a bunch of them.
Right. And we can go over those again at some point.
Dr. Cal, Can you get the pneumonia and the flu vaccine at the same time, or should you wait like 2 weeks or something like
Yeah,
that?
you can. Yeah, you can. But the pneumonia vaccine, you have to get 2 injections.
Okay.
But yes, you can. I got. Yeah, you can get them both at the same time.
Do you,
But the pneumonia vaccine that requires shots.
you recommend getting a pneumonia vaccine?
Yes, if you're over 65, yeah, absolutely. And also the shingles vaccine.
Dr. Calendar,
Yes.
when this coronavirus vaccine does come out, now, if people don't want to take it, what happens? People are going to die or what?
But people don't want to take it, they don't take it, and they get, if they get the virus, they have the same thing that happens with people today. Some people will die and some people will do fine. It looks like about 10% of the people who get the infection die from it. So, so with that, but who's to say? We know that, for example, the article we discussed last week, or maybe we discussed today, yeah, shows that for children, the group that is more likely to get it and die are the Latino Hispanic population, much more than the African American population, twice as much as, and incredibly much more than the white population. It almost makes you think about some of the things that Darrell said some time ago, as though this virus that has tendencies towards wiping out people of color. But I just say that to say that we know that for in the adult population, that African Americans are more likely to die from it. So, so you got a 90% chance that you'll be okay, but a 10% chance that you will die from it. And so, now this is the test that is now very accurate. You can see 100%, 94% sensitivity and 100% specificity, meaning that you don't have any false negatives. I'm sorry, you have no false positives and very few false negatives. The tests that we have today, they're associated with about a 20% false negative and positive. And so this test is better. And then, of course, now many places are, and there was an article that Trump emphasized that he's sending out millions of tests so that you can have as many people tested as possible. Possible.
Dr. Calendar,
yes.
I'm sorry, what? I never understood the rationale that Trump was using for less testing. What was that about?
I know.
He's changed now. He's now trying to get as many people tested as possible. That rationale was, I don't want to use the term that's desirable for that rationale. I would just say that it is not desirable and that it is not worthy of even repeating.
Okay.
Because now he's recognized it and he wants to get as many people tested as possible.
Okay.
His presidency is been associated with so many negative aspects that negative, as a role model, he is an incredibly awful role model.
The word stupid comes to mind. I don't know if that's appropriate, but yeah.
Well, yes, there's a lot of presidents you got to compare with to make it worse.
Right.
But
I can say that, but you as a doctor probably shouldn't say that. But yes, I can say that.
The word clown comes to my mind.
Right.
I know where you got that from, Sylvia. Biden said that last night.
Don't you remember when Trump first got in, no one could say anything derogatory, use profanity about Trump, and they were making arrests and all that. So if you go in Washington, D.C. and you see most stop signs, blank Trump, They stopped that completely.
I know.
Isn't it amazing how in the beginning when Trump took office, everybody was alarmed that they used anything derogatory or anything against Trump, and they made it against the law. You cannot do that against our president. Now, all of a sudden, everybody is saying it.
Oh, freedom of speech is an illusion, but it's. I won't say any more about that. This is what it alarmed a lot of people who, we had this discussion already about the October vaccine surprise that Trump issued. And then his fact that he could legally authorize a vaccine over the objectives of experts. It was even more frightening. And I think what's happening is that more minorities are recognizing the need for us to be involved in the vaccine process. And so there are more Black presidents and college presidents and other Blacks who are being involved in studies involving minority institutions now that they didn't have before. So even though the results of these will not be available before the election, in spite of what Trump says. As a matter of fact, some of the earliest results will be available in November and after the election. But so his announcement will just turn out to be a mistake.
But don't you think that he knows that? Because that's what he's saying. Everything is going to come out and be available after the election date. That's what he keeps saying, that everything is going against him. So everything's going to be ready after election.
Before election.
Yeah.
But it's actually going to be available after the election.
After election.
Now, if it's available before the election, then he will look like a great president.
This is what he said. The vaccine will be ready in a matter of weeks.
We will end it keeps the pandemic from China.
Yes, the China flu, whatever you call it. Yeah.
Even call it the Kung flu.
Yeah.
Very sick, man. Very sick.
It's really been trying this year has been like a nightmare because
It has.
The pandemic, and also because of the way he's responded to the pandemic.
Yeah.
Because, having the problems is not an issue. It's how you respond to the problem. It's the way he's responded that has frightened many people.
Yeah.
He's given bad advice out. He's flip-flopped.
Yeah.
He's changed his mind on things.
Yeah. And he said to
Only say it
inject
in jest.
bleach, put bleach in your body.
Only say it in jest.
He doesn't joke. Has anybody noticed that? Well, I have never seen Trump smile or laugh or tell a joke. I've never seen it.
Yeah. Yeah.
I've heard his jokes.
Oh.
He tells them every day when he tries to talk.
But guess what, Chris? Are those really jokes?
Yeah, you can't take him seriously, right?
They're somewhat
When he's
jokes.
talking crazy, he smiles. When the
Uh-huh.
bleach thing and Lysol, he's smiling. He smiles all the time. That's because he's crazy.
Those are called fake
Yeah.
smiles. Those are fake smiles.
This is an article that talks about our efforts to using masks and social distancing have decreased the amount of flu that occurs, which is interesting because the number of people who get the flu and people who die from the flu is likely to be reduced this year because of the things that we're doing to keep from getting coronavirus. The only fearful aspect of it is that if people don't get the vaccine, we talked about the herd immunity. That will lessen the likelihood of us having the herd immunity that is protecting us even now. So it becomes even more important to emphasize that people get the flu vaccine.
You know what? We're going to be wearing masks for a very long time.
Yeah.
I'm talking about all the way into next year. And even after they get vaccinated, let's say we get a vaccine for
Yeah,
coronavirus.
I agree.
You know,
Well, we'll wait and see. We'll
yeah,
see.
I don't want to bring doomsday, but we're going to be, people are just going to naturally just start wearing masks because they don't want to get anything else.
Yeah.
Well, it's the same thing happened in 1918. For 2 years, they had that.
Oh my goodness.
Yeah, for 2 years. Yeah. Now, this I thought was an interesting article about the risky activities to do right now, that doctors rate. And there's a list: going to church or a bar, the highest risk activities for COVID exposure.
Oh, yeah.
That's not a surprise, but that's what it is. What it is. Yeah. Then running at the top 5 are attending a conference at a hotel.
Oh, my gosh.
I'll go back up to it because you passed it.
Mhm.
Yeah, go back up a little bit because they identified the top 5. And yeah, attending a conference at a hotel, going to a large dinner party, and commuting by train or bus. Now, what is problematic about that is that who rides the train or bus? People who are in the lower socioeconomic strata.
Right, frontline. Yeah.
Yeah, so that's it's frightening. That,
People of color. Yeah.
yes, that's us. That's
Yeah.
us.
Yeah.
With the exception of Dr. Callender.
Well, used to be. Right now, it's fearful to ride a train or bus. I used to do that every
Very
single day.
fearful. Very.
Every single, huh? And then they what you see following is a list of activities where they put 1 to 5 on a scale. 5 was the top, and 1 was low. And so these are the top 20.
Oh,
And number
wow.
1, concert, indoor. Now, if you had outdoor services, it'd be interesting, but indoor services, going to bar inside, they keep emphasizing that. Going to a movie theater is
Oh, my. That's
number 6. Traveling by commercial airplane. Remember we looked at that. We looked at that last time. Going to a movie theater, high contact sport, hugging or shaking hands.
You know,
Sending kids to camp or daycare.
Dr. Callender, my college actually canceled the game for this week because 18 of the players are isolated and 10 of them are in what do you call it? Confinement on campus.
Quarantine.
Quarantine, thank you. Because they contracted COVID.
What school is that?
Notre Dame.
Wow.
Really?
Notre Dame. And they had an outbreak on campus. I think it was 150 kids.
Really?
I mean,
Oh, my gosh.
there are almost 9 or 10,000 kids on campus, but 150 of them got it.
Mm-mm.
My goodness.
So they're supposed to go back on the 10th, not this Saturday. They canceled the game against Wake Forest.
Oh,
And
really?
there's a professional football team that had to cancel because so many of their
Yeah.
players got COVID also.
Yeah.
So
But it's
this is-
interesting, the basketball players at the bubble did well. but they were
Yeah.
isolated. They couldn't go outside. That's the
They couldn't
difference.
even go home. That's right.
Right. Yeah.
Look
Dr.
at
Calendar, what do you suggest for like the holidays and the family gatherings? And should you tell
Yeah.
every family member, I want you to be tested? I want you to, what do you do? I mean,
Yeah.
You asked a great question for
Yeah.
which we don't know the answer yet, because the answer will depend upon what is the rate of disease in your area. And if it's right now, you'd have to cancel that.
Oh my gosh. For
If it were like it
Thanksgiving
is
and
now.
Christmas?
Christmas too.
Well,
Yeah.
Thanksgiving at least.
I think you're
If it
gonna
were like it is, but maybe different in November.
need, I think you're going to need Zoom family gatherings.
Mm.
Oh,
You have to have
Yes.
small family gatherings.
Yes.
But when you talk about small for a family, 20 is kind of small. And,
John, go back up. I wanted to talk about number 17. This is why I don't have any visitors.
well, especially not.
maybe that's my problem.
What do you do about your grandchildren?
Oh, he's just joking. Don't listen to him.
But let's, on the serious side, though, started nursing home where you have a lot of residents there. The lady last week told me that they can't even let relatives come in and visit them.
Yeah, that's true.
No
Right.
visitors.
Right.
That's right.
So if
Yeah.
you're, and so Dr. Calendar, we talked about this before about the loneliness factor that is developed by this quarantine. You can't go see people. You just have to
Yeah.
call them on the phone, I guess.
Well, that's one of the most important negative aspects. I think Chaplain talked about the fact that she couldn't visit her, what is it, your brother?
Yes, in the group home. No.
Right. Yeah.
Yeah.
And you're right. The loneliness aspect is, the mental aspect of it is overwhelming.
Very much.
And but having your children and grandchildren come to visit you becomes an issue
Oh.
for the elderly grandparents like us.
So how can we have sometimes at least, hug a grandchild then?
Well, you have to have masks and social distancing and no hugging. That's
Oh,
that's hard to do with.
oh
But
my.
how do you handle it? You have 9 grandchildren, Carol. How do you handle it?
Well, since this is being on podcast, I can't say this out loud.
I'll tell you one thing, Dr. Calendar. I believe this. I don't know if it's true or not, but 2 people who are negative for COVID-19 should be able to hug each other.
Oh, that's okay. Yeah, I agree.
Okay.
Yeah.
Because I thought earlier that we said something about even though you were negative, contact tracing takes place and you could be asymptomatic and spread it.
Well, but I guess everything has an aspect of reality. And if you, for example, if you're living with somebody and you're both going to the same places and you're both negative, it's unlikely that you would be different now. So I would think that hugging is okay in those circumstances.
And we talked about this earlier too, Dr. Callen. We talked about, I think I brought it up, having a COVID negative party. Everybody at the party is COVID negative and they can.
That's dangerous.
Okay.
The problem with that is that,
That's
okay,
dangerous.
you get tested, and
Right.
Yeah.
when is the party? Is the party the same day you got tested and got your results?
Yeah, if it's the
Okay,
same
where-
day, it's okay.
Where did you go after you got tested?
Yeah.
Exactly. So you, and once you get tested, you would have to quarantine yourself.
Got to be in a bubble. That's right.
Yes.
That's the
yes.
only way.
Yeah.
Actually, that was something that we had discussed doing like a Deep Creek getaway and renting a house with other people. And we said that for the ones that want to participate, they would have to go and get tested. And most results, they come back in 2 to 3 days. And I believe like Walgreens or CVS, they do same day results. But you will have to quarantine yourself until it's time to go and check in at Deep Creek.
Oh my goodness.
Yeah. So I mean, it's pretty much essentially the same thing as what John has said, a COVID-free party. So,
yeah. And by the way, John, what's the information you got, Buchanan, relative to Asbury and
Shiloh? Nothing. I've got no response for Christmas yet, and you know, I think as far as the choir is concerned, that's not going to happen. You know, that's not going to happen. And I think in-person services, I don't think that's going to happen either. It's sad, very sad. I've been playing at Shiloh for 40 years, and this will be the first year that, you know, that we won't have it. I'm just guessing that. I haven't heard back. You know, normally we would already have notification of the rehearsal and the performance and all that, but I doubt if it's going to happen this year. Sad.
Okay.
So Dr. Callender, when Sylvia asked that question, that is really something. Thanksgiving's coming up.
Yeah.
And Christmas. And that's one of the holidays that family does get together. And my children have asked me, what are we going to do for Thanksgiving?
I know. Me too.
And I'm just saying, well, wait. Now, I haven't stopped seeing them. I guess I should. But anyway, I still see them. But I was just thinking, and we still get together. But for Thanksgiving and Christmas, how does everybody feel about that? Janice, I know you see your grandchildren.
I do see my grandchildren, and I've been thinking about Thanksgiving. And yes, Dr. Callender, 20 is a small group. So this year, just immediate, meaning my 20 might be down to 15. But, you know, sometimes, you know, I'll have as many as 30 people. So this year, Thanksgiving, I will not have a large group.
Yeah.
Christmas, it might just be Chris and his family. You just can't be around large crowds, and then they're not in your bubble, so you don't know where they've been. Definitely this year is going to be different.
Yeah, I think that's
I see myself more in my home Thanksgiving than in Christmas, and more might mean 15, but they're the ones that I see on a regular basis.
Yeah.
No, we're going to have 50 people this year, Mom.
How many?
I know, and I can count on you to help with cooking, like I counted on you this week to get this thing off my machine that John sent me.
Well, this is the last one we'll do today. We'll save the rest till next.
This is nice.
Now, I have a all-day meeting on next Thursday, so we'll have to cancel the meeting for next Thursday. We have a conference that's bears my name, so I kind of have to go to it.
Yeah.
Yeah, so now I thought this was an interesting one to end on, that China, where the pandemic started, gives Howard University 25,000 masks. That's interesting.
That was nice. Very
that was nice. That was very nice. Yeah. I was surprised that Trump has nothing to say about that, but anyway.
Doc, what about this one?
I think it's very hard for Trump to give anybody kudos.
That was interesting as well.
That is nice. Where are they building this? Where is it going to be built?
On our grounds.
Oh, that is nice. Very nice.
Yeah.
Yeah.
They deserve it.
Alright.
They deserve it.
Yes, they do. They do. This is very nice.
The only thing I can say
I thought
about
that was interesting that this guy who was the DC government minister is now vice president of at Howard University. And they
Oh,
looked into the ethics and found there was no problem. Although, if it's no problem, I wonder why they fined him $2,500.
Yeah.
But anyway,
Mm.
they found no ethics violation.
oh.
That's interesting. But anyway, $225 million tax abatement.
Yeah, that is very nice. I like
Yeah.
it. Yeah.
Wow.
Oh, also like to say, our President, Dr. Frederick, he was on Channel 4 every day for I think about a week. They had special on him.